The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
Hi, this is retired Army Captain Dr. Tommy O'Brien. For 25 years, I devoted my practice and military career to not only medically treating my patients, I have educated and guided them to a healthier lifestyle which improves the quality of their lives. Please contact me by visiting drtommyo.com. That's drtommyo.com. As an osteopathic medical physician, I am able to offer more than one would expect from an MD. I apply hands-on manipulation in concert with medical treatments to not only treat the illness, but the effects as well. Additional services I provide include medical weight loss and medical marijuana. Please contact me by visiting drtommyo.com for an immediate appointment. If you don't have medical insurance, or if your medical deductibles have not been reached or are very high, I offer an easily affordable membership program which allows you unlimited visits for a small monthly premium. Please contact me by visiting drtommyo.com. drtommyo.com, or call 631-980-8200. That's 631-980-8200. And let's put you on the track to a better health and better healthcare at an affordable rate. Welcome to the Ask Dr. Tommy O Show. I am your host, Dr. Thomas O'Brien. The Ask Dr. Tommy O Show can be heard every Wednesday at 4 p.m. on 103.9 LI News Radio. I offer a very affordable concierge practice which allows you access to quality care you really deserve. With no rush office visits, both you and I can discuss your healthcare needs. As your primary care physician, it is important for me to have a baseline knowledge of your health. A history and physical is the starting point of the patient's story. This is the time when our physician-patient relationship begins. The patient will explain their past medical history and mention their medications. I will then perform a thorough exam. This is where I look, listen, and feel. I look at the patient while they're speaking to me, I listen to what they're saying, and I feel them both physically and emotionally. This way, when you come to my office not feeling well, knowing your history allows me to properly diagnose and treat your illness. To maintain a clean and safe environment, my office has several ultraviolet C-wave lights to sanitize and kill bacteria and viruses. To my military family, I got your six. To my Masonic brothers, the light is bright. I have a catchphrase that says, if you wait, it's too late. And that's so important. I need you to have a full understanding of what that means. If you wait, it's too late. Right? When we have cars, right? You hear a little knocking. What do? We run to the auto mechanic and you have them, evaluate it and make the correction. Well, why don't we treat ourselves the same way? When you buy a brand new car, what do we say? To maintain that car, in medicine, we say healthcare maintenance. What do? Every 3,000 miles, we change the oil. Well, we don't change the oil in a body, but you want to come in for a history and physical. You have baseline blood work. And then from that point on, we go into healthcare maintenance. Based on age, we have benchmarks of certain things that we need to test for. I covered that on my screening show. For men over 50, a PSA. For women, every year, once they're sexually active, a pap smear and breast exam. There's certain screening tests that you must have every single year. Why? Remember, if you wait, it's too late. We want to get on top of this before we start to show signs and symptoms. If we start to see signs and symptoms, we're getting to the point where it's too late. All right, so before I discuss today's topic, which is skin cancer, I would say, reduce high-risk behavior. Well, 2 weeks ago, I was a dummy. I went out. I was in the sun. It was Sunday because I don't really have much time to work on my home. And so I need to do yard work. We all need to do yard work. So, I had to clean out my garage. I had to do some power washing. I had to work on my koi pond. Well, I didn't wear a hat and I didn't have sunscreen on, so I was in the sun for 9 hours. So what do you think happened? I got myself a sunburn, and not only a sunburn, it was a first-degree burn. It's a sunburn, typical sunburn, but I got a little sun poisoning. I just wasn't feeling well for the next 2 days. That was not smart. My wife reminded me that I was a dummy and I should have had a hat on and sunscreen, or at least a shirt with long sleeves, to protect my skin. All right, so now on to today's topic, skin cancer. Before we dive into skin cancer, first let's define what cancer is. A lot of people will hear, you know of someone or family member that has cancer, and we don't understand why some people die from cancer and some people survive. So let's define cancer itself. Cancer is the uncontrollable cellular division of the prefix, meaning the tissue type or what is known as the cell line. For example, breast cancer is the uncontrollable cellular division of breast tissue. Prostate cancer is the uncontrollable cellular division of prostate tissue. Therefore, skin cancer is the uncontrollable division of skin tissue, okay? Or the skin cell line, because there's all different cell lines within the skin. Therefore, there's going to be different types of skin cancer. It's very important. Every year, when you go to your physician, they should examine your skin, okay? And if your physician's not doing that, your physician should refer you to a dermatologist so they can do a routine skin exam. Again, a screening test. You have to be proactive, not reactive. Reactive, that means it's too late, okay? That means there's symptoms and you're not feeling well. So let's be proactive, and you want to do healthcare maintenance, and in this case, annual skin screenings. You should perform daily skin exams, and if you can't do it every single day, that's fine, but at least, once a month, look at your skin, because you're the first line of defense. You're going to see something a lot sooner than your physician will. So if you see something that you're not sure of, you're unsure of, then what you should do is make an appointment with your physician. Come in and see me. That's what I'm here for. I'm here for you, to educate you, and my doors are open, and you have access to the quality care you deserve. Come in and see me, and then I'll take a look at it, and then we'll determine what's the proper care. Do we need to be aggressive, or we can take a conservative approach? All right, so according to the American Cancer Society, skin is by far the most common type of cancer. There are several types of skin cancers. The first one, basal cell cancer. The second is squamous cell cancer. The third is melanoma, and everyone knows melanoma, because that's the prognosis is not good with melanoma. Then we have a very rare form, and that's Merkel cell. And then you have lymphoma of the skin, and then Kaposi sarcoma. Most of these I have never seen. I've seen basal cell, squamous cell, melanoma. I have never seen a patient with Merkel because I'm not a cancer physician, a hematologist, or an oncologist. I've never seen a lymphoma of the skin. However, because I practiced in the South Bronx for 16 years, the South Bronx is the leader for HIV and AIDS. So first you have HIV, and that's where you have the virus, and the virus attacks your immune system, and your immune system gets weaker. We got the CD4 cells, and those are your recruiter cells, and they recruit your killer cells, and they tell them, hey, listen, there's a foreign body in the body. We need to kill it. All right? So then you have your what we call viral load. When the virus is in your body and it's growing exponentially, your viral load increases, and what happens is your CD4 count decreases. So we have a number. When the CD4 count is below 250, we know that there's going to be secondary complications, even tertiary complications. And unfortunately, patients that are in what we define as AIDS, they have what's defined AIDS. That's when your viral load is extremely high and your CD4 count is below 250, and you start to experience the secondary and tertiary associated diseases. And that's what we call AIDS, okay? Patients can live and survive with HIV. However, patients will die because of AIDS, okay? And that's the secondary and tertiary conditions associated with HIV. In this case, that's when you start to see Kaposi's sarcoma. So this condition I did see not often, but especially when I was in medical school, when I was in residency, this is in the mid 90s, when we were just coming out with the HIV cocktails. So we didn't have the HIV virus under control. And so we saw a lot of patients that had HIV and AIDS. And with those patients, we saw a lot of Kaposi's sarcoma. All right, so I got about 50 seconds getting ready to wrap up this part of the show, and then we'll continue on. So if you're looking for a physician, you're not happy with your current relationship, you're looking for someone who's looking caring, who wants to look, listen, and feel. Most physicians, they're not even listening to you, they're not even looking at you, just typing away. I don't offer that. I look at you. I'm listening to you. I'm here for you. That's the service. I practice traditional, old school family medicine. And in addition, osteopathic, so I do manipulate as well. No need to go to a chiropractor. I will do it all. So give my office a call. I got to say that backwards. Give my office a call at 631-980-8200 or go to drtommyo.com. That's drtommyo.com. Welcome back to the Dr. Tommy O Show. I'm your host, Dr. Thomas O'Brien. Today's topic, skin cancer. So let's continue. Just to go over, I just want to, so you have an understanding. I offer a very affordable concierge practice at the price of less than the cost of a monthly cell bill. And this allows you access to quality care you really deserve with no rushed office visits. Both you and I can discuss your healthcare needs. To learn more about my practice, go to drtommyo.com. That's drtommyo.com, or give me a call at 631-980-8200. So skin cancer, as I said, what is cancer? Cancer is the uncontrollable cellular division of the prefix. And what is the prefix? The prefix is the cell type, the cell line. In this case, we're talking about skin cancer. So what is skin cancer? Skin cancer is the uncontrollable cellular division of the skin cells, the skin tissue. So I just got through discussing the different types, basal cell, squamous cell, melanoma, Merkel cell, lymphoma of the skin, and Kaposi. So out of all of these, I've seen basal cell, squamous cell, melanoma, and Kaposi's sarcoma. I've never seen Merkel or lymphoma because I'm not in an oncologist or a dermatologist, because they just see pure volume and eventually they will see these conditions. But the others over my career, I have seen individuals who've had this condition. So what do? I see something abnormal. I'm looking at the we look at the what we call a lesion. I'm looking at the size. I'm looking at the shape. And then if I see something I don't like, I send the patient to a dermatologist, and they have a dermatome, and they can take a look. It's a magnifying glass, and then what they'll do is take a biopsy and then send that down to the lab, and the pathologist will determine if it's just atypical cells, or if it is a cancer. And depending on the cancer line, will determine how we treat this particular tissue. So basal and squamous cell cancers are the most common types of skin cancer. There's a saying, above the lip, basal cell, and below the lip, squamous cell. Well, these are like board questions. What does that mean? Statistically, that when we see lesions above the lip, like the ears and the top of the face, the forehead, or even the scalp, statistically, it will be a basal cell. And if it's below the lip, the chin, and the neck, statistically, squamous cell. However, you can have a basal cell below the lip, and you can have a squamous cell above the lip, and on the ears and the forehead. Just going based on statistics. Basal cell. It's estimated that 8 out of 10 skin cancers are basal cell carcinomas. Basal cell carcinoma is found deep within the skin, which is the lower part of the epidermis. Okay, so you have the dermis, epidermis, all different layers of the skin. We don't have to get into all that. All you know is it's going to be deep in the skin, deep within. That's all. Keep it simple. These cancers usually develop in sun-exposed areas, especially the face, head, and neck. As I said, above the lip. Basal cell cancers tend to grow slowly, which is good. It gives you time, to make decisions, do biopsies, and determine how we're going to treat this condition. Basal cells rarely spread to other body parts. Okay, again, this is a plus. We don't, cancers that spread, they're difficult to treat. So this is going to be localized. But the key here is to be proactive. You see something on your face, you need to come in, see me. We'll determine if we need to be conservative or aggressive, and we're going to send you out to a dermatologist or to a skin surgeon, a oncologist skin surgeon, and they will take it from there. Squamous cell. It is estimated 2 out of 10 skin cancers are squamous cell carcinomas. Squamous cell carcinoma is found near the surface of the skin. Basal cells deep. Squamous cells closer to the surface. Why? Because there's a different cell line. Again, there's different cells, different cell lines within the skin. These cancers commonly appear on, again, sun-exposed areas of the body, such as the face, ears, neck, and lip, the backs of the hands. As opposed to the basal cells, squamous cell cancers can spread to other body parts. So this one, again, you got to be a little bit more aggressive, because the longer you wait, what do I always say? My catchphrase, if you wait, it's too late. You see something you don't like, you see, what we call a lesion, you see something in skin, you see a mark, you see some darkening of the skin, you think it's a freckle. Well, maybe a freckle, could be a lentil, I'm not sure. Come on in. Let's take a look at it. Let me look at it, and I can determine if we need to be aggressive or not. Be proactive, not reactive. You see something, say something, do something, okay? Come on in, and then we'll get the appropriate care. If you wait with this condition, because this, squamous cell does migrate and spread to different areas. We don't want that. We want you to be proactive. Come on in so we can catch it in its early phase. Melanoma. Melanoma is a type of cancer with uncontrollable cellular division of the melanocyte. What is the melanocyte? The melanocyte is the cell that gives the skin its color. All right, so if you're light skinned, you'll have a light complexion, your melanocytes are not that active. If you have darker complexion, that means your melanocytes naturally are more active. So if you have light skin and you go out into the sun, you get a tan. Well, what do? We stimulated the melanocyte, and the melanocyte basically turned on. I mean, it's always on, but it basically became more active, and that gives you your tan color, okay? It changes your complexion, and you get a little bit darker, okay? So melanoma is much less common than the other types of skin cancers, specifically basal cell and squamous cell. However, melanoma is much more dangerous because it's much more likely to spread hematogenously. Okay, that's a tough word to say. And what does that mean? That means it's spread through the bloodstream, and it spreads to other parts. That's why melanoma is so dangerous, and you see the morbidity so high. When I send a patient to a dermatologist and they do a biopsy, and they come back and they say it's melanoma, my first question is did it hit the bloodstream? How deep is it? If it hit the bloodstream, that is, I'm concerned now, okay? Because we have to be very aggressive with the treatment because this can pop up. The melanoma can spread to any part of the body, okay? Yes, you can get melanoma in the eye. That's why we do an eye exam. It could be anywhere in the body. It spreads through the blood, so we got to be very, very aggressive with treatment there. And then the, survival rate, 5-year survival rate is low because it spreads. We don't know when it's going to pop up and where it's going to pop up. So, it's almost like a reactive treatment. So, you got to be aggressive. You see, be proactive. You see a lesion, you have to come in to see me and let me help you make the best decision. All right. So I can get you into that care you need and we can treat it, be proactive, not reactive. All right. How do we treat? Well, we treat with curettage and electrodissection. Then you have a moth surgery. A lot of people have heard of moths, and it leaves a scar because they're removing layers of skin, and then they seal it. So you'll see people that have scars, especially on their forehead and their faces, around their nose. Excisional surgery, radiation therapy, photodynamic therapy, cryotherapy, laser surgery, and topical medications. So I've seen in my career the moths, I've seen excisional, cryo, and laser therapy. Again, if you specialize in this area, you're going to see more of those procedures or treatments. The ones I just mentioned, that's the ones that I've seen. What treatment's best for you? I'm not sure. That's why I need to get you into a dermatologist or a skin specialist who specializes in skin cancer because they can make the best decision for you. All right, so what do we do? Prevention, reduce high-risk behavior. Wear sunblock, wear a wide rim hat, white t-shirt with sleeves and glasses. All right, so getting ready to wrap up the show, skin cancer. If you're looking for a physician, you're not happy with your current relationship, give me a call. To learn more about my office, my practice, go to drtommyo.com. That's drtommyo.com, or give me a call, 631-980-8200.
The content heard on the Ask Dr. Tommy O Show is for informational or educational purposes only and does not substitute professional medical advice or consultation with healthcare professionals.
The views and opinions expressed on this program are not necessarily those of this station, JVC Broadcasting Management, or its sponsors.